Hello everyone, good day. My name is Andy, third year nursing student from Negros Oriental State University. So today I'll be going to talk about the substance abuse disorder. I'm going to discuss the introduction, what is it all about, the cause, the criteria, and the symptoms, and also the types of substance abuse disorder. Okay, so I'm going to start. Substance abuse or used and related disorder are a national health problem. The actual prevalence of substance abuse is difficult to determine. It's because many people meeting the criteria for diagnosis but they don't seek treatment. And surveys conducted to estimate prevalence are based on self-reported data that may be inaccurate. And globally, alcohol misuse is fifth leading risk factor for premature death and disability. Among people at the age of 15 to 49 years, it is the leading risk factor. And there is two groups of substance-related disorder. These are the substance abuse or use disorders, or also known as addiction, the substance-induced disorder, or the intoxication, and the withdrawal. So let's differentiate each of them. So addiction is a psychiatric disorder that occurs when a person is psychologically dependent on a substance, or it is a condition of being addicted to a particular substance. Intoxication is a use of substance that is in a maladaptive behavior. Withdrawal syndrome refers to the negative psychological and physical reactions that occur when use of substance ceases or dramatically decreases. What is substance abuse? Substance abuse can be defined as using a drug in a way that is inconsistent with medical or social norms and despite of negative consequences. Substance abuse disorder, or also known as SAD, are common chronic relapsing illness that are characterized by drug-seeking and drug-taking behaviors that persist despite negative consequences. Substance dependency occurs when a person uses substance to feel normal. Initially, the person uses substance to relax, and the polysubstance abuse more than one substances. Criteria for substance abuse or use disorder. Substance use disorders span a wide variety of problems arising from substance use and cover 11 different criteria. So these 11 criteria, we're going to discuss each of them. So the first one is took more extensive amount or extended time, using the substance in a larger amounts or for longer than it's meant to be. The second one is repeated efforts to control, use, or quit. Meaning a person's want to cut down or stop using the substance but not succeeding. The third one is full time spent using. So it is consuming a lot of time getting, using, or recovering from use of the substance. The fourth one is craving. It is desires and urges to use the substance. The fifth, disregarded major rules, meaning not accomplishing what is need to be done at work, home, or school because of substance use. The sixth one is social or interpersonal dilemmas, resuming to use even when it causes problem relationships. The seventh, missed activities, giving up significant social, occupational, or recreational activities because of substance abuse or use. Hazardous use, using substances again and again, even when it places the persons in danger. Physical or psychological problems, meaning extending the use of even physical or psychological problems arises. Tolerance, requiring more of the substance to get the effect the person desires. The last one is the withdrawal, development of withdrawal symptoms which can be alleviated by taking more of the substances. In order to be diagnosed with substance use disorder, the person must meet two or more of these criteria within a 12-month period. And if a person has two or three of these criteria, that person has a mild substance use disorder. And if 4 to 5, it is considered as moderate substance use disorder. And if the person has 6 or more criteria, that person has a severe substance use disorder. Causes. So the exact cause of drug abuse, dependence, and addiction are not known, but there are various factors are thought to contribute to the development of substance-related disorder. Symptoms. Drug addiction symptoms or behaviors include feeling that you have to use the drug regularly, or it could be daily, or even several times in a day. Having intense urges for the drug that block out any other thoughts. Over time, needing more of the drug to get the same effect. Taking larger amounts of the drug over a longer period of time than you intended. Making certain that you maintain a supply of the drug. Spending money on the drug even though you can't afford it. Not meeting obligations and work responsibilities, or cutting back on social or recreational activities because of drug use. Continuing to use the drug even though you know it's causing problems in your life or causing your physical or psychological harm. Doing things to get that drug that you normally wouldn't do, such as stealing, driving, or doing risk activities when you're under the influence of the drug. Spending a good deal of time getting the drug and using the drug or recovering from the effects of the drug. Failing in your attempts to stop using it. Experiencing withdrawal symptoms when you attempt to stop taking the drug. Types of substance use or abuse. So there are 7, but I will just going to enumerate them because later on we'll be going to discuss each of them. Okay, so the first one is alcohol. The second one is sedatives, hypnotics, and anxiolytics. And the third one is stimulants or amphetamines or cocaine. The fourth one is cannabis, or also known as marijuana. And the fifth one is opioids. And the sixth one is hallucinogens. And the 7 is inhalants. But in the other book, there are 11 types of substance abuse or use. So these are alcohol, sedatives, stimulants, cannabis, or also known as marijuana, opioids, hallucinogens, and inhalants, caffeine, cocaine, nicotine, and phencyclidine, or also known as PCP.
Hi guys, my name is Cherise. So it's my turn to discuss with you the treatment and management of substance abuse related disorder. So to start off, let's talk about the medical management of substance abuse. The term Alcoholics Anonymous was founded in the 1930s by alcoholics. This self-help ground developed the 12-step program model for recovery, which based on the philosophy that total abstinence is essential and that alcoholics need the help and support of others to maintain sobriety. Treatment programs usually offer individual, group, or family therapy sessions, a focus on understanding the nature of addiction, becoming drug-free and preventing relapse, and lastly, levels of care and settings that vary depending on your needs, such as outpatient, residential, and inpatient programs. The goal of detoxification, also called detox or withdrawal therapy, is to enable you to stop taking the addicting drug as quickly and safely as possible. Detox may involve gradually reducing dose of the drug or temporarily substituting other substances such as methadone, buprenorphine, or a combination of buprenorphine or naloxone. As a part of a drug treatment program, behavior therapy, which is a form of psychotherapy, can be done by a psychologist or a psychiatrist, or you may receive from a licensed alcohol and drug counselor. Therapy and counseling may be done with an individual, a family, or a group. The therapist or counselor can help you develop ways to cope with your drug cravings, suggest strategies to avoid drugs and prevent relapse, offer suggestions on how to deal with relapse if it occurs, Talk about issues regarding your job, legal problems, and relationships with your family and friends. Include family members to help them develop better communication skills and be supportive. And lastly, address other mental health conditions. Many, though not all, self-help support groups use the 12-step model first developed by Alcoholics Anonymous. The self-help support group message is that addiction is a chronic disorder with a danger of relapse. Self-help support groups can decrease the sense of shame and isolation that can lead to relapse. Included drugs are lorazepam. These drugs is used for alcohol withdrawal. Chlordiazepoxide. Like lorazepam, these drugs is used for alcohol withdrawal. Disulfiram. These drugs maintains abstinence from alcohol. Methadone. It maintains abstinence from heroin. Levomethadil. It maintains abstinence from opiates. Naltrexone. It blocks the effects of opiates and it reduces alcohol cravings. Clonidine. It suppresses opiate withdrawal symptoms. Acamprosate. It suppresses alcohol cravings. Thiamine. This prevents or treats Wernicke-Korsakoff syndrome in alcoholism. Folic acid. It treats nutritional deficiencies. Cyanocobalamin. It also treats nutritional deficiencies. Assessment include history, thought process and content, sensorium and intellectual process, general appearance and motor behavior, and self-concept. Based on the assessment data, the major nursing diagnoses for substance abuse are risk for injury related to substance intoxication or withdrawal, ineffective denial related to underlying fears and anxieties, ineffective coping related to inadequate support system or coping skills, imbalanced nutrition less than body requirements related to drinking alcohol instead of eating nourishing food. And lastly, chronic low self-esteem related to retarded ego development. Treatment outcomes for clients with substance use may include the following. Client will abstain from alcohol and drug use, will express feelings openly and directly, will verbalize acceptance of responsibility for his or her own behavior, will practice non-chemical alternatives to deal with stress or difficult situations, and lastly, will establish an effective aftercare plan. So that's the end of our first video. We hope you learned something, but we're not done yet because in our next video, we're going to talk about more things about substance abuse. Thank you and see ya!